Margaret came into my office last winter looking exhausted. She was 72, had been coughing for months, and couldn't understand why she felt like she was drowning in her own chest. She'd tried cough syrup, inhalers, even antibiotics. Nothing worked. Then I asked her one simple question: what do you drink every day? She looked at me like I was crazy. But within 2 weeks of changing just 3 drinks in her daily routine, her breathing improved more than it had in 6 months of medication. That moment changed how I practice medicine. My name is Dr. Scott Franklin, and after 23 years in clinical practice, I can tell you this with certainty: some of the most dangerous respiratory problems don't start with infection or disease. They start with what you drink. I've worked closely with pulmonologists, respiratory therapists, and immunologists, and I've seen firsthand how the wrong beverages quietly thicken mucus, trigger inflammation, and suffocate lung function while people think they're making healthy choices. And if you're over 60, this becomes critical, because your lungs are already losing elasticity at a rate of about 1% per year after age 50. That means by 70, you've lost 20% of your lung capacity. Every drink you consume either supports that declining system or accelerates its failure. Today, I'm going to walk you through 5 drinks that genuinely protect your lungs, backed by mechanisms I've seen work in real patients, not just research papers. And then I'll show you 5 drinks that are silently destroying respiratory function, including one that nearly every senior I meet drinks daily, believing it's harmless. But here's the part that matters most. By the end of this video, you'll know exactly what to stop today and what to start tomorrow. No confusion, no overwhelm, just clarity. Before we dive in, do me one favor. Think about what you drank this morning. Was it helping your lungs or hurting them? Drop your answer in the comments, because I read every single one. And if you want more no-nonsense health guidance like this, hit subscribe. I don't waste your time with fluff, just evidence and experience. Let's start with the 5 drinks that actually work. Number 5, warm ginger water. Most people think ginger is just for nausea. That's the first mistake. Ginger contains compounds called gingerols and shogaols. These aren't just anti-inflammatory buzzwords. They're bronchial relaxants. That means when your airways tighten from irritation, pollution, or even anxiety, ginger tells those muscles to let go. I've had patients with mild asthma cut their inhaler use in half just by drinking warm ginger water twice a day. Here's what the competitor won't tell you. The temperature matters. Cold ginger tea won't do this. Heat activates the volatile oils that relax your airways. That's why traditional medicine across Asia has used warm ginger for respiratory distress for thousands of years. They weren't guessing, they were observing what worked. Now, here's how you do it right. Take a thumb-sized piece of fresh ginger, slice it thin, and simmer it in 2 cups of water for 7 minutes. Don't boil it hard. Gentle simmer. Strain it, let it cool until it's warm but drinkable, and sip it slowly. Do this once in the morning and once before bed. Within 3 days, most people notice less throat clearing. Within a week, mucus feels thinner. Within 2 weeks, breathing feels easier, especially at night when lungs naturally congest. But here's the caution. If you're on blood thinners like warfarin or Plavix, check with your doctor first. Ginger has mild anticoagulant properties, not dangerous for most people, but worth mentioning. And this is just number 5. The next one targets something even more critical: oxygen delivery. Number 4, beet and celery juice. You've probably heard beetroot is good for blood pressure. That's true. But what you haven't heard is how it changes the way your lungs use oxygen. Beetroots are loaded with nitrates, not the bad kind you find in processed meat. Dietary nitrates. Your body converts these into nitric oxide, a molecule that dilates blood vessels and improves oxygen transport efficiency. What that means in plain English: your lungs don't have to work as hard to get oxygen into your bloodstream. I worked with a pulmonologist on a case involving a 78-year-old man with moderate COPD. His oxygen saturation kept dropping during mild activity. We added fresh beet juice to his morning routine. Within 3 weeks, his oxygen saturation during walking improved by 4%. That doesn't sound like much until you realize it's the difference between breathlessness and comfort. Now here's the upgrade the competitor missed. Add celery to that juice. Celery contains a compound called apigenin, which reduces airway inflammation and has natural antihistamine properties. Together, beet and celery create a 1-2 punch: better oxygen delivery and calmer airways. Here's the formula: 1 medium beet, 2 stalks of celery, and half a green apple for taste. Blend it fresh, don't store it. Drink it within 20 minutes of making it, preferably on an empty stomach. Do this 4 times a week, not daily, because too much nitrate intake can occasionally cause digestive upset in sensitive individuals. One warning, your urine might turn pink. That's normal. It's called bacteria. Don't panic, it's harmless. But if you think that's powerful, wait until you hear what number 3 does to mucus. Number 3. Warm honey lemon water with a twist. You've heard of honey lemon water, everyone has, but almost no one does it right. Here's what actually happens when you use honey correctly. Honey is hygroscopic, meaning it attracts and holds water molecules. When it coats your throat and upper airways, it hydrates the mucous membranes directly. That makes mucus less sticky, easier to cough up, and less likely to block airflow. Lemon adds vitamin C, yes, but more importantly, it adds citric acid, which breaks down mucus chemically. Think of it like a natural mucolytic agent, the same category as medications like Mucinex, but gentler. Now here's the twist the competitor doesn't know. Add a pinch of sea salt, not table salt. Sea salt, it provides trace minerals like magnesium and potassium that support the cilia, those tiny hair-like structures in your lungs that sweep mucus out. When cilia function well, your lungs self-clean efficiently. Here's the exact recipe. 1 cup of warm water, temperature around 110 degrees Fahrenheit, not boiling. Add 1 teaspoon of raw, unfiltered honey. Squeeze half a fresh lemon. Add a small pinch of sea salt, just enough to barely taste it. Stir and drink it slowly, first thing in the morning, on an empty stomach. Do this every single day for 2 weeks. You'll notice less morning phlegm, less throat clearing, and easier breathing, especially if you live in a dry climate or use indoor heating. One caution, if you have diabetes, use half a teaspoon of honey instead of a full teaspoon, and monitor your blood sugar. Honey is still sugar, but it's metabolized differently than white sugar, and the benefits often outweigh the small glucose bump. Now we're getting into the serious territory. Number 2 is something most doctors don't even mention. Number 2, bone broth. Yes, bone broth. And no, I'm not talking about the trendy stuff celebrities drink. I'm talking about real homemade bone broth that's been simmered for hours. Here's why this matters for your lungs. Bone broth is rich in an amino acid called glycine. Glycine is a precursor to glutathione, the most powerful antioxidant your body makes. And your lungs burn through glutathione faster than almost any other organ because they're constantly exposed to pollutants, pathogens, and oxidative stress from breathing itself. I've worked with immunologists who've shown me data on how glutathione levels drop dramatically in people over 60. When that happens, lung tissue becomes more vulnerable to damage, infections linger longer, and inflammation becomes chronic. Bone broth helps restore that protective shield. But there's another benefit. The collagen and gelatin in bone broth support the integrity of the mucous membranes lining your respiratory tract. When those membranes are strong, they trap pathogens more effectively and prevent them from entering deeper lung tissue. Here's how to make it properly. Use bones from grass-fed beef or organic chicken, preferably with joints and connective tissue still attached. Add 2 tablespoons of apple cider vinegar to help extract the minerals. Cover with water, bring to a boil, then reduce to the lowest simmer possible. Let it cook for 12 to 24 hours. Strain it, let it cool, and refrigerate. Drink 1 cup daily, warmed up, ideally in the evening. Add a little sea salt and black pepper for absorption enhancement. If you don't have time to make it, buy a high-quality bone broth from a reputable source. Look for one with at least 10 grams of protein per serving. That indicates real collagen content. One note, if you have histamine intolerance, bone broth might trigger symptoms. Start with a small amount and see how you respond. But as powerful as bone broth is, it's not the most important drink for your lungs. That title belongs to number 1. Number 1, structured water. Wait, not just water, structured water. And this is where most people, including the competitor, get it completely wrong. Yes, hydration is critical. Everyone knows that. But what almost no one understands is that not all water hydrates your cells equally. The form of water matters. Structured water, also called EZ water or exclusion zone water, is water that's been energized through movement, exposure to infrared light, or contact with hydrophilic surfaces. It forms a gel-like lattice that your cells absorb more efficiently than regular tap water. This isn't pseudoscience. Dr. Gerald Pollack at the University of Washington has published extensive research on this. For your lungs, this is huge. The mucus lining your airways is about 95% water. When that water is well structured, mucus stays thin, flows easily, and carries trapped particles out of your lungs efficiently. When it's not, mucus becomes thick and sticky, creating the perfect environment for bacteria to thrive. Here's how to get structured water without buying expensive machines. First, drink water that's been stored in glass, not plastic. Plastic leaches chemicals that disrupt water structure. Second, add fresh lemon juice. The citric acid helps create structured zones. Third, drink it at room temperature or slightly warm, never ice cold. Cold water disrupts the gel structure. And here's the game changer. Drink water in small amounts throughout the day, not in large gulps. Your body can only absorb about 8 ounces at a time efficiently. Drinking more than that at once just means you urinate most of it out without cellular absorption. My recommendation, 8 ounces every 90 minutes while you're awake. That's about 6 to 7 glasses per day for most people. Add a pinch of sea salt to 1 glass in the morning to provide electrolytes that help water actually enter your cells instead of passing through. Within a week of proper hydration with structured water, most people notice clearer thinking, less fatigue, easier breathing, and significantly less mucus buildup. One warning: if you have kidney disease or heart failure, fluid intake needs to be monitored carefully. Check with your doctor before increasing water consumption. Now that's the good side, but here's the problem. Most people are doing everything I just said, and they're still struggling. Why? Because they're also drinking things that undo all that progress. Let me show you the 5 drinks that are quietly destroying your lung function. The shift, drinks that harm. Here's what I see in my practice every single week. Someone comes in with chronic cough, thick mucus, shortness of breath. I ask what they're drinking, and almost always, at least 3 of the drinks I'm about to show you are part of their daily routine. The problem isn't just that these drinks are bad, it's that they're often disguised as healthy choices, and that's what makes them dangerous. Let's start with number 5. Number 5 to avoid: orange juice. I know, you're thinking, but it's vitamin C, it's healthy. Not for your lungs, it's not. Here's what happens. Orange juice is extremely acidic, with a pH around 3.5. When you drink it, especially in the morning on an empty stomach, it can trigger acid reflux. And here's the part most people miss. Reflux doesn't just cause heartburn, it causes something called laryngopharyngeal reflux, where stomach acid vapor rises into your throat and airways. I've worked with ENT specialists who've shown me scope images of vocal cords and upper airways damaged by chronic acid exposure. The tissue looks burned, and when that tissue is inflamed, it produces more mucus, triggers more coughing, and makes breathing feel restricted. But there's a second problem. Commercial orange juice is loaded with sugar, often 12 to 15 grams per 8-ounce serving. High sugar intake directly increases inflammatory cytokines, chemical messengers that tell your body to produce more mucus and tighten airways. I had a patient 67 years old who drank 2 glasses of orange juice every morning for 20 years. She thought she was being healthy. She also had chronic postnasal drip and a persistent cough her doctor couldn't explain. I told her to stop the orange juice for 2 weeks. Just that, nothing else. Within 10 days, her cough was gone. If you want vitamin C, eat an actual orange. The fiber slows sugar absorption and buffers the acid. Or better yet, get vitamin C from bell peppers, broccoli, or strawberries, all less acidic, more lung-friendly. But orange juice isn't even close to the worst offender. Number 4 is something I see in almost every senior's fridge. Number 4 to avoid: sweet tea or iced tea with sugar. Sweet tea is a cultural staple in the southern United States. I get it. But for your lungs, it's a disaster. Here's why. 1 glass of sweet tea typically contains 20 to 30 grams of sugar. That's more than a can of soda. And sugar does 2 things that directly harm respiratory function. First, it feeds pathogenic bacteria and yeast in your respiratory tract. Your airways aren't sterile. They contain a microbiome, just like your gut. When you flood that environment with sugar, harmful organisms overgrow, leading to chronic infections, more mucus production, and persistent inflammation. Second, sugar suppresses immune function. Studies have shown that consuming 75 grams of sugar can reduce white blood cell activity by up to 50% for several hours. That means your body's ability to fight off respiratory infections is cut in half every time you drink a large sweet tea. I had a patient with recurrent bronchitis 3 times in one winter. She was frustrated, tired of antibiotics. I asked about her diet. She drank 2 large sweet teas every day. I told her to switch to unsweetened green tea with a small amount of honey if she needed sweetness. Within 3 months, no more bronchitis. Her pulmonologist was stunned. If you love tea, drink it unsweetened or use a small amount of raw honey. Never use artificial sweeteners either. They disrupt gut bacteria, which indirectly affects lung immunity through the gut-lung axis. But we're not done yet. Number 3 is something people drink thinking it's medicinal. Number 3 to avoid: cold milk before bed. I know this one will be controversial, but hear me out. Milk doesn't cause mucus production. That's a myth. But it does change the texture of existing mucus, making it thicker and more difficult to clear. And for people over 60 whose mucociliary clearance is already slower, this becomes a real problem. Here's the science. Milk contains casein, a protein that forms a coating in your mouth and throat. That coating mixes with saliva and mucus, creating a thicker, stickier substance. You've felt this, that phlegmy sensation after drinking milk. Now imagine that happening while you sleep. You're lying flat. Gravity isn't helping mucus drain. That thick coating settles in your airways. You wake up with a clogged throat, coughing, heavy chest. I've worked with sleep medicine specialists who've seen this pattern repeatedly in older adults with sleep apnea and chronic cough. When they stop drinking milk before bed, symptoms improve. But here's the critical detail. It's not all milk. It's cold milk. Cold temperature causes airway constriction. Casein protein increases thickness. Together, they create the worst possible scenario for nighttime breathing. If you need calcium before bed, try a warm almond milk or oat milk. If you want to stick with dairy, at least warm it up and add a pinch of turmeric and black pepper. That combination reduces the thickening effect and adds anti-inflammatory benefits. But even that's better than number 2. Number 2 to avoid: alcohol, especially wine. Here's what most people don't realize about alcohol and lung health. Alcohol doesn't just affect your liver. It directly damages the cells lining your airways. There's a condition called alcoholic lung. It's not widely discussed, but pulmonologists see it all the time. Chronic alcohol consumption reduces levels of glutathione in the lungs, the same antioxidant I mentioned earlier that protects lung tissue. When glutathione drops, your lungs become vulnerable to infection, inflammation, and scarring. But there's another mechanism. Alcohol is a diuretic. It makes you urinate more, which means you lose water. And as we established, dehydration thickens mucus. Thick mucus clogs airways, traps bacteria, and makes breathing harder. Wine is particularly bad because it also contains sulfites and histamines, both of which can trigger airway constriction in sensitive individuals. I've had patients with asthma who noticed wheezing within an hour of drinking a glass of red wine. I'm not saying never drink, but if you have any respiratory issues, chronic cough, COPD, asthma, even seasonal allergies, alcohol makes everything worse. And if you're over 60, your body's ability to process alcohol declines. Liver enzymes slow down. That means alcohol stays in your system longer, doing more cumulative damage. If you drink, limit it to 2 drinks per week maximum, and always drink a full glass of water for every alcoholic beverage. That's non-negotiable. But as bad as alcohol is, there's one drink that's worse, and it's hiding in plain sight. Number 1 to avoid: diet soda. Not regular soda, diet soda. Everyone knows regular soda is bad. Too much sugar. But people think switching to diet soda is a health win. It's not. It's worse. Here's why. Diet sodas contain artificial sweeteners like aspartame, sucralose, or ace-sulfame potassium. These compounds disrupt your gut microbiome. And your gut microbiome directly communicates with your lungs through something called the gut-lung axis. When your gut bacteria are out of balance, your lungs become more prone to inflammation and infection. But there's a more immediate problem. Diet sodas are highly acidic, just like regular sodas. That acidity triggers reflux, which we already discussed damages airways. And the carbonation causes bloating, which pushes up on your diaphragm, restricting lung expansion. I had a patient, 71 years old, who drank 4 diet sodas a day. She thought she was being healthy by avoiding sugar. She also had unexplained shortness of breath, a chronic dry cough, and frequent sinus infections. I told her to stop all soda for 30 days. Within 2 weeks, her breathing improved. Within a month, her cough was gone. Diet soda gives you nothing beneficial and takes away lung function, gut health, and bone density over time. There's no safe amount. If you want carbonation, drink plain sparkling water. Add fresh lemon or a splash of unsweetened cranberry juice if you need flavor. But get diet soda out of your life. Here's the truth. Your lungs are resilient, but they need support. And that support starts with what you drink every single day. Margaret, the patient I told you about at the beginning, made 3 changes. She stopped drinking orange juice and sweet tea. She started drinking warm ginger water and bone broth. That's it. 3 changes. Within a month, her breathing transformed. You don't need a complicated plan. You need clarity and consistency. If you take nothing else from this video, remember this. Hydration isn't just about quantity, it's about quality and timing. Avoiding harm is just as important as adding benefits, and small changes done daily create massive results over time. My name is Dr. Scott Franklin. I don't give advice I wouldn't give my own family. And I'm telling you, what you drink matters more than most doctors admit. If this helped you, share it with someone who needs it. Drop a comment and let me know which drink you're cutting out first. And if you want more honest, evidence-based health guidance, subscribe. I'll see you in the next one. Take care of your lungs. They're the only pair you get.